Basal implantology is science with 30% surgical part and 70% post-surgical prosthetic part. Though both are equally important, post-surgical occlusal checkup and continuous follow-up is very important. This is the first contraindication for basal implant case selection. If patient will not engage with you for the next 3 months, then reject that patient, because if there is no follow-up, then case will definitely fail. Some important facts about this science. Number 1. According to the corpse analysis, there should be minimum 8 implant in maxilla and 6 implant in mandible. We can put more implant but not less than this. Second line of principle is your implant must engage buttresses and cortices, because these are the areas of bone which are most stable, infection free and resorption free. Some examples of these are nasal floor, orbital rim, pterygoid fossa, zygomatic buttresses, base of the mandible, lingual cortex which is just below the mylohyoid ridge. According to Buch, if your implant placement is flaring, then it will increase your supporting polygon. See which chair is most stable. These are some images which explains how supporting polygon increases. Along with this, high insertion torque, rigid splinting make it possible immediate functional loading. Now we will see how to engage the buttresses and cortexes. In mandible, lingual cortex engagement along with the nerve bypass. In lower 7-8 region, palpate mylohyoid ridge area just below the mylohyoid ridge is our target area. Drill direction in this area should be slightly oblique and in posterior or distal direction. Once you feel there is a lingual perforation, just pick up that length and engage the implant. In mandibular anterior region, place the implant between mental foramen, and implant should be directed towards the midline. Also, palpate mandible buccolingually first to orient the mandibular resorption pattern and start drilling according to that. After a certain point, you will feel resistance at the base of mandible. That is the point where you should engage the implant. To place pterygoid implant to avoid cantilever, the target region is a pterygoid fossa. First, palpate the hamular notch. It is a depression situated between the maxillary tuberosity and the hamulus of medial pterygoid plate. Your direction of drill should be towards this notch. First implant drill should start at the mid crest region. After starting with to and fro drilling motion, when your drill drop in the fossa, that is the point where you should stop and take that as your implant length reference. For the second pterygoid placement, the entry point is slightly buccally converging toward the first one. In maxillary anterior region, the target area is nasal floor. First palpate maxilla buccolingually to feel the resorption pattern. In highly atrophic cases, you can place implant most toward the palatal region. Start drilling at alveolar crest and directed towards the nasal floor. At certain point, you will get drop. That is your reference point for the implant length. Try to put implant converging at the apex to achieve tripodization. When all implants are in place, you can now bend implant for your prosthetic framework. Your prosthetic framework should be on alveolar ridge and lower prosthesis will be according to the upper prosthesis. Thank you very much.